to talk a little bit about COPD right now. Dr. Maddur Badarinath is on the line with us right now. Dr. Badarinath is a pulmonary and critical care physician at Bronson Critical Care and Pulmonary Medicine Specialists in Battle Creek. Good morning, doctor. Nice to have you with us.
Good morning, Tim Collins. It was nice to be on the line.
We hear a lot about COPD, chronic obstructive pulmonary disease, but I have no idea what it is, and my dad is diagnosed with it a little while ago.
Yeah, COPD, if we use the term, it includes three different kinds of conditions called emphysema, chronic bronchitis, and non-reversible asthma. This condition involves increasing breathlessness. There is no cure for COPD. Our job as physicians is to intervene by accurately diagnosing COPD and offering treatments to manage COPD and to help patients breathe easier and to have an improved quality of life.
Yeah, in my father's case, he gets a little winded when he's out working, I notice, and he has to stop and rest a little bit. But I have a friend who's been diagnosed longer, and he has to rely on oxygen tanks. So is it progressive? Does it get worse and worse?
Yeah, you're correct. It's a progressive disease, and many of the treatments we offer can slow it down, and also if we can prevent further worsening. For example, if they're smoking, if they quit smoking, the condition might even stabilize. But there are patients, even if they quit smoking, it may continue to progress, but at a slower rate. Same thing with if there is infection, mold, other irritants in their work environment, if you can avoid that. Some people do feel a lot better. And the treatments also have to slow down the process of progressive disease, and a good education certainly helps.
Now, you mentioned smoking, Dr. Badarinath. If someone smoked earlier in life and had quit for a long time, do you see that they might have higher incidence of COPD later?
That's correct. Anybody who has smoked earlier age and the duration of smoking, that contributes to the lung damage, and that is not reversible. So if you have smoked for a long time, quit, still you can start developing your symptoms. If you don't have symptoms, some of the tests we do can diagnose COPD in the early form. So quitting smoking does help, but it doesn't prevent you from catching COPD at a later age.
You mentioned the test, doctor. What do you do to diagnose COPD?
Once we have a good history, we do what's called a spirometry. It's done in all the doctor's offices and in our pulmonary offices. It's a simple test where you breathe out through a small tube, and that's connected to a meter that will show us how much you can breathe out in 1 minute and then another in 6 minutes. So this kind of, in seconds, this will give an idea how good your lung is performing. And if you repeat this test with treatment and after some time, if it shows improvement, that means you are responding to the treatment. And that gives a guide to assess how much you're progressing or improving.
Now, are there medications then that can reduce the symptoms?
Yes, we use 2 or 3 different kinds of medications. One is good to prevent shortness of breath. It works right away. We use the term, the name is albuterol. Most people know it. And there is a second medication we add to this. And sometimes we use what's called steroids. It comes in the form of pill as well as inhalers. So a combination of these medications, depending upon which symptoms are predominant, would help patients feel better and improve the quality of life.
Once someone's been diagnosed with COPD, is this something that is eventually going to be fatal?
Uh, if continues to progress faster, it can, because it does produce other complications of the heart and rest of your body. And also, people who have smoked for a long time, they're also at risk for different kinds of cancers, not only lung, could be larynx, bladder, and other organs. So it's very important to diagnose this, confirm it, and then do other tests. Some people can be short of breath for other reasons other than COPD. So if you have any suspicion, we do what's called CAT scans and certain blood tests. When I mentioned blood tests, there is one kind of COPD. Even people who have not smoked can get COPD because of a genetic enzyme deficiency. There's a simple blood test that's good for somebody who has got COPD who never smoked. So if somebody has a family history of COPD, it's worth getting this test done, especially if you never smoked or not exposed to any pollutants.
So what can we do, Dr. Badarinath, then to get tested and to make sure that we're okay?
Yes, if you talk to your family doctor or they come to our clinic, if we suspect that, we do a simple blood test. Within few days, we'll get the result. Then we'll counsel the patient, and then there's some recommendations we can do to prevent the worsening of the COPD if they already have.
Well, I appreciate you being with us, Dr. Maddur Badarinath. I know a lot more about COPD than I did just a few minutes ago. Thank you once again.
Thank you for inviting me.
From the Bronson Battle Creek Hospital Studios, News Talk 95.3 WBCK, Battle Creek, a Town Square media station.